So now Myrhe and I are into something great, something different. 3 countries will present to you their national digital health strategy, and you as an audience are going to take a vote. So I would like to urge you for now to reach to the app. If you haven't downloaded it, please do it right now, because you are to say whose country has the best digital strategy. So I would love to welcome to stage Kathrine, Razvan, and Ron. Ta-da! Please give a round of applause. Come on up. Kathrine, hi. Hi there. Thank you. The guys are not coming? Oh, yes, they are. Razvan. Nice to see you. Hi there. Hi. Hi. Myrhe, take us hand to hand in terms of what the rules are and stuff like that.
So the rules are each debater has 2 minutes to open with a strategy. And after that, then we have 2 questions to the debaters, and each debater then has 1 minute for closing summary. I hope I did that right. That was I'm not quite sure I did that right, but hopefully I did. So will I invite the first debater to the podium, or are you going to do that?
I could imagine indeed that we take all 3 of them to take their digital strategy at first. And okay. I think Kathrine is starting with it.
Okay. Yeah. First, actually, you asked me to present myself. Who are we and who we're representing?
Is your mic on?
I think so.
Can the mic from Kathrine turn on?
Okay. Anyway, yeah.
Yeah.
Okay, my name is Kathrine Myrhe, and I'm heading a cluster in Norway. It's called Norway Health Tech, and we represent 250 different actors. We organized as a non-profit membership organizations, and the full ecosystem of health innovation is actually part of the cluster. So that's me. You want me to continue with my strategy?
Please do.
Thank you. So, as you can see from the map, Norway is a very small, it's a large country, long, but it's a small population, 5.2 million people. Most people live in the cities, the capital Oslo being the largest one, 700,000 inhabitants. However, there are also a lot of people living by the coastline, all the way up in the north, and in the rural and forest-covered areas, close to the border of Russia. The harsh climates, long coastline, people living up in the mountains have made people need to be innovative and solution-oriented. Norway has a universal healthcare and single-payer system, all people having access to the health system paid by the public. We organized our healthcare system in 4 health regions, being responsible for hospitals and specialized care. And we have as much as 420 municipalities that are responsible for the primary care. The diversified system makes it sometimes challenging being a patient, going back and forth in the different system, and even more challenging actually being industry delivering solutions. Who is paying isn't necessarily the one getting the effect of the new solutions. All Norwegians get a personal number when we are born, and traceable health data has been stored for the last 50 years. So we do have a great collection of interesting data registries, which we now are about to take in use for R&D and for new solutions being developed. The Norwegian government has a large focus on giving all people in Norway access to good health services, also those living in the rural areas. This is one of the reasons why the government put up a plan for implementation of digital health solutions. A consequence of putting health high up on the agenda in Norway is that we also spend money on health. Norway is by OECD ranked number 4 in GDP spending. And with a large growth in elderly population and more getting chronic diseases, the growth in healthcare spending is expected to grow from 16 to 20% between 2016 and 2060. That is not sustainable, not even for Norway, and a big motivation, again, for putting efforts and a focus on digital health solutions. But we do have a fantastic asset in our health industry. For the last 4 years, we have had a growth in the industry of 10 to 12% annually. And as much as 12% of the industry are startups, and 1/3 of these are recognized as born globals. This represents a huge growth potential in the Norwegian health industry. We have put together a collaborative ecosystem where we focus, or when we focus on the challenges, we combine them with the industry and the R&D that actually can solve these challenges. And we're getting better and better at actually taking in use the new solutions. We have set up programs for cross-collaborative collaboration, meaning that we take use of technology and people from oil and gas sector and defense sector and put them into the health sector. And right now, it's booming on the startup scene. And again, digital health solutions being the area of most startups and most growth. So, being only 5.2 million people, Norway is a very small home market. That is one of the reasons why we consider the Nordics as a home market, and also collaborate a lot on the Nordic scene with regards to health innovation and testing and clinical validation of new technology solutions. In November last year, we launched the Nordic Network of Test Facilities. March this year, we became members of something called Excite International. I know that the Netherlands are as well. And only 2 weeks back, we launched a concept for a national test and development center for digital health solutions. So, if we are able to bring good solutions to the Norwegian and Nordic market, we would very much like to also bring them to the global market. So, putting an effort and the focus on acceleration and export program is also part of the plan. Importantly, the strategies are anchored in the parliament, at the governmental level, of course, at the ministries, in the industry, and in the healthcare sector. So, if you ask me, Norway is ready to go. We are ready to take and use patient and user-friendly solutions that creates better healthcare, save costs, and at the same time build a sustainable and digital health industry. Thank you.
Thank you very much.
Thank you, Kathrine.
Razvan, could you introduce yourself as well a bit?
Of course I can.
In 140 characters, like in a tweet.
Exactly, and just about 45 minutes, right? So, good evening, everyone. My name is Razvan Vulcanescu. I'm the president of the National Health Insurance House in Romania, previously Secretary of State in the Ministry of Health, and I was privileged to lead the team that designed the new e-health strategy, and also the healthcare strategy 2014-2020. Let me just start by saying this. Healthcare is a uniquely complicated system. Costs and benefits don't always line up, and they don't line up with the interests of those responsible for change. So there is a need for a huge push required to force action in a broader interest of the society. Two of the key commodities of the 21st century, I think, are data and time. What do we want to do? We want to use data to buy time. Let me say that again. We want to use data to buy time. And we want to do that for our patients, for our medical personnel, and for ourselves, in order to do more and to do it better. That is why in 2014, Romania adopted the new health strategy as an action plan designed to meet the ex-ante conditionalities of the EU and also to ensure access to the EU funding available in the programming period 2014-2020. The approach in designing it was a dual approach, using both top-down but also bottom-up approach. But what we never admitted doing, and I'm admitting it tonight, was that the main goal was no longer to offer key decision makers only the possibility to access available funding and to do the right thing, but rather the responsibility to do it. Because it's really the case of what we mentioned in the strategy, it's what we wanted to do, now we have to do what we have said. In Romania, the healthcare expenditure was around 7 billion euros in 2017. Not enough to cover a population of roughly 20 million people, but with which we managed to cover costs for almost 10 million beneficiaries last year. The population is divided 60 to 40%, urban versus rural, and most healthcare providers, both public and private, are present especially in the urban areas. The healthcare administrative institutions are the Ministry of Health and the National Health Insurance House. National Health Insurance House is in charge of managing the healthcare fund, contracting and reimbursing services to both public and private healthcare providers. But what also National Health Insurance House is doing is in charge of coordinating and developing the e-health platform in Romania. And the platform is comprised of the e-prescription, which we introduced in 2013, the e-health card, which we introduced also in 2013, the electronic patient's dossier, it was introduced a year later in 2014, and the unique integrated information system, which basically gathers all the information about healthcare in Romania. What do we want to do next? On the basis of the healthcare strategy, we have applied and we have received funding to develop further the IT platform and to basically close the whole loop. And in doing so, we intend to, first of all, extend the procedures in order to have an e-medical leave and an e-medical referral in place, and also to extend the electronic patient's dossier to all the healthcare providers in Romania. What do we want to do further? We want to keep the legacy of previous presidencies, like the Dutch, like the Estonian presidency, hopefully like Austria next, and also put things into perspective for following presidencies. Because e-health is a top priority in Romania, and we'll make a showcase of that during our 2019 EU Council presidency. Thank you.
Over to Ron.
Thank you, Lucien. Ron Roozendaal, Director of Information Policy and CAO of the Dutch Ministry of Health, Welfare and Sports. As said before, we are all patients, as are our friends, our kids, our parents, but we also all are doctors, as we share decision-making with our caregivers. And shared decision-making demands shared information, the same data for the doctor and the patient. Therefore, we gave every Dutch citizen the legal right to download and use their own data. And that's why our Dutch approach focuses on giving everyone the tools to become CEO of their own health and masters of their own health data, to better prepare for a doctor's consult, for example, to share data with their caregivers, or even to share data with researchers for improving treatments. But a law is not enough. And even technology, it's not enough. It's all about trust and information exchange. And that's where our Dutch national program, Medical Me, or in Dutch, Myrhe, comes in. It's a patient-led coalition of insurers, healthcare providers, IT industry, and the government, and it's governed by our Health Information Council. Together, we develop and test a trust framework consisting of a set of standards to enable exchange of personal health data with patients. Of course, based on international standards and on best practices, providing industry with a fertile ground to design innovative personal health environments that really help us all to master our own health. Using Myrhe, everyone can safely download their own medical data into their own personal digital vault, adding their device-generated or other health data, securely sharing it with their healthcare providers. It's not a fantasy. It starts this summer. It creates an amazing opportunity for innovation, as the number of Dutch innovators present today show. It creates a whole new ecosystem of empowered patients requiring innovative services. In the next 3 years, every hospital in the Netherlands will have implemented these standards. General practitioners and pharmacies are already adopting those too, and many others are joining the movement. I invite you all to do so too. Think big, act small, start today. For example, by visiting our Dutch house at this conference, and we welcome you to our movement.
So now it falls to me. Was my mic on? Yes.
Yeah.
It falls to me to ask the questions. So Kathrine, I'm going to start with you, and if the question is good enough for Eric, it's good enough for our panelists here. So what are you most proud of in what you've just talked to us about and presented?
Well, first of all, as you know, Norway being a very wealthy nation due to the oil and gas, we could have decided just to put more money into the system. More money, more money, more money. But what the government decided to do is, first of all, make the plan and follow the plan, but also putting up strategies for building new industry in order to come up with new solutions. So not only a program for introducing digital health solutions, but also for creating a new industry. So it's actually a kinder egg. You both create a better healthcare system, fully covered by the public sector, but at the same time you create new, you're creating jobs, right? And you're creating tax coming into Norway. So that's one thing. The other thing which, for those of you who also have public healthcare systems, know that sometimes it's hard to get the public side actually to react. We have been able to create this collaborative platform, partnerships between the health government, locally, regionally, and nationally, the health providers, patient organizations, R&D, and the industry working together with the aim of solving the large health challenges. 5 to 7 years back, if a company knocked on the door of the hospitals wanting to collaborate, finding out what are actually the large challenges in order to solve them, they would, you got the smack on your hands. You were not allowed to. But now, this is common how we work, actually. So we're not only talking about it, we are actually doing it, which is good.
Thank you. And the next question I want to ask you then is, and I just want you to pick one, what is the biggest lesson, what's the biggest learning that you have got through this process?
Well, when we started looking at digital health solutions, all 420 municipalities thought that everyone had to pilot and test new technology and test new technology. But that is not sustainable for the healthcare system, and for the industry, it doesn't scale. So one of the lessons learned is that, well, one municipality can pilot, and then from the learnings of that piloting, the rest can buy. And also we see municipalities, for example, it's a municipality called Kristiansand in southern Norway. They gather 30 other municipalities together, and they are creating a large consortium of municipalities now doing one procurement process. And that is, lessons learned, and we're doing something about it.
Thank you, Kathrine. So I'm going to move on to Razvan now, and I'm going to ask you the same question. I'm first going to ask you, what is the biggest learning that you had through this process that you could share with us?
Probably the biggest learning was that you should never give up. And in doing so, we managed to achieve something that was never achieved before. We managed to convince the Ministry of Finance and the Parliament that we needed better funding for the healthcare sector in Romania. And we did not accept their no. So what we managed to do is to change the legislation and to tackle a different approach in encouraging and basically offering tax deductibility for private health insurance as a means to input new funding into the healthcare sector. We managed to do that in 2016. We managed to introduce the availability of tax deduction for both employer and employee, and it was basically a change of paradigm. And in 2017, we saw a rise in 70% of the private health insurance system in Romania.
Thank you. And then the next question is, what are you most proud of through that whole process?
It's really the recognition, the satisfaction, and also being able to change mentalities. It was really that process, but another thing goes back in my mind. In 2014, the e-prescription solution that we introduced was actually received the top prize at a London IT fair as the enterprise solution of the year. So we basically proved that what we managed to implement in Romania was recognized not only in Romania, but also abroad. And what we managed to do is to take a significant step forward in changing the mentalities of the patients and also the medical personnel, that digitalization is to their own good.
Thank you so much. So finally we come to Ron. And Ron, your biggest learning from this process that you could share with us?
The biggest learning is that healthcare and healthcare information exchange cannot be changed top-down. It needs a bottom-up cooperation of patients, insurers, doctors, and all others involved in healthcare.
And what are you most proud of through this process?
I'm most proud of that we actually achieved the start of the movement. Can I have the lights on in the audience, in the auditorium? Is that possible? I wear pink socks today. Whom of you have pink socks? Can you please stand up? Just stand up, please. Just move. You've been sitting far too long. Look around. This movement started just 3 years ago at HIMSS. Just 3 years ago. So what I'm proud of is that we achieved the power of movement to change healthcare in the Netherlands. I'm proud that patients like Annemiek are in the room, insurers like Han, doctors like Felix, or CMOs like Felix, and doctors like Gabriel. I'm proud that we started a movement.
Thank you, Ron. So now that we've asked the questions, each of you get 1 minute to do a summary, and then we'll get voting.
And that's 1 minute sharp.
1 minute sharp.
I've been signaled from backstage.
So Kathrine, please start.
Okay. Well, Norway has been so lucky finding oil and gas outside our coastline. What we did with oil and gas is what we now are doing in the health, combining the challenges and potential in health with our innovative mindset. The user perspective and competence and technology developed both at universities, in the oil and gas, aerospace, IT, and health sector in order to solve the large health challenges ahead. UN has defined 17 goals to create a more sustainable world, of which health is the third goal. If Norway comes up with health solutions that will save lives, save costs, and make better and more sustainable health systems for the patients and society, Norway also has an obligation to provide those solutions to the rest of the world. That is what my organization, the Cluster Norway Health Tech, together with the hospitals, municipalities, companies, politicians, investors, R&D and the health innovation ecosystem in Norway is heading for. Thank you.
Thank you, Kathrine. And next, Razvan, your 1 minute starts now.
Thank you. I think digitalization is an act of transcendence, and I think everyone should be involved. It's really a case of tell me and I will forget, show me and I might remember, involve me and I'll understand. And what do we need to do? We need to encourage leaders to step up. And leaders can be any one of you. Leaders can be in every sector, from politicians, from hospital administrators, from healthcare administrators, universities, and so on. Secondly, we need to empower people, and we need to offer strong support to the leaders, strong support from the experts, from working groups, from networks. Thirdly, use data. Better use of data to make health systems more effective, innovative, and fair, reducing inequalities between member states. Thank you.
And Ron?
Well, I just keep it short, and I just repeat Eric's call for action. Think big, act small, start today, and be the change to make us all masters of our own health.
Thank you.
Well, thank you very much. So now it's up to you as audience. Pick up your phone, open the app, go to the HIMSS mobile app, select the Q&A portion of it. In it, you can select the welcome keynote section, and the polls are at the top of the screen. And then please vote. The votes, as you can see over here, you can vote for either of the digital strategies, and the votes will show up on the screen, and it gives you a bit of a 1.5 minute time to make the actual choices. Maybe meantime, a bit of a great music. Maybe Batman? Thank you. Go ahead. Yeah. Yeah. Or you could play on until these scores are up. You could play on until the scores are coming up.
This is like the Eurovision.
This is Eurovision. Ici le point de Royaume-Uni, you know. No, okay. Well, it definitely looks like we've got a winner. Can I see the results back, please? I think we've seen that it was the Netherlands. Great job. So, thank you everyone for sharing your votes. Congratulations, the Netherlands. Thank you for the other contestants. Thank you for sharing your vision, strategy, and all the hard work that you have been doing. And please stay on it because I think it's very needed. So, thank you very much for now. Warm round of applause, please. And thank you, Myrhe, as well. Thank you very much. So, over to the last part of this evening session. It's an honor to invite Chris Pointon to the stage. Chris will conduct a background on the Kay Granger Award. He will introduce not only the why and the how about that. So, Chris, thank you very much for us.
Thank you. Good evening, everyone. Hello, my name is Chris Pointon. 4 words that have become quite iconic and synonymous across healthcare, and you're all proudly wearing those 4 words on your delegate badges at this amazing conference. I'd like to say thank you to HIMSS for kindly sponsoring the award and inviting me to present the awards this evening. Dr. Kay Granger Mbe, my beautiful wife, who died aged just 34, a name that is linked across the world to compassionate care. She epitomized compassion in everything that she did, as a doctor, as a patient, and also as the most beautiful human being in the world, and truly epitomized person-centered care, which is everything healthcare should be. Now, despite Kate and I's 5-year journey with cancer, Kate wrote 2 books. She raised over £250,000 for charity. We're now at £360,000 for charity. Our target for the end of the year is £500,000, which we will achieve. And her legacy will be one of creating the hashtag Hello My Name Is campaign that, like I said, you're all proudly wearing. Despite the adversity that Kate was going through in life, and despite the torment that she went through with her 5-year journey with cancer, she still managed to create that legacy and still managed to make a difference in the world. Despite the adversity, she created that legacy. And she also became a consultant. She died at the age of 34, but she still managed to achieve her lifelong ambition of becoming a consultant within the NHS. And she was also made the youngest ever fellow of 2 colleges, and she received an MBE from Prince Charles. So it just goes to show that irrespective of what you are going through in life, you can all make a difference. And Kate and I's mantra in life was always to play the cards in life that we've been dealt, because they're the cards that we've been dealt. Nobody can change that for us, so we had to make the best job that we could of those cards, and we did the best job that we could. And like I said, Kate died almost 2 years ago now. And the reason why the campaign's so successful is it takes very little time to do, it costs very little money, and it makes a difference to patient experience. So my question to you guys and to everyone is, why would you not want to embrace the hashtag Hello My Name Is campaign? So moving on to the awards, and after sifting through many nominations, I would now like to announce the winners of this year's awards, starting with the Team Award. So this team, after piloting innovative high-fidelity simulation training for mental health with a local hospital, this team established the world's first centre for mental health simulation using innovative training methods to bridge the gap between education and clinical practice. This improves communication, it improves teamwork and collaboration to improve the patient experience, and that's something that Kate strived for in everything that she did and everything that I now do on my 12-month sabbatical. So I would like to announce the winner of the Team Award is the Maudsley Simulation Team from NHS Slam in the UK, and invite the team to the stage to receive the award. Well done. Thank you so much. Congratulations.
Thank you.
Congratulations.
Hello, my name is Dimeji.
Congratulations.
Hello, my name's Vanessa.
Hello, my name is Jose, and we are part of the Maudsley Simulation team. Simulation is such a wonderful tool that has enabled us to train teams in a multi-professional setting, whereas previously healthcare professionals have been accustomed to be training in silo. Through this, we've been able to sort of carry on some of Dr. Kate's work by giving and enabling sort of professionals that whereas before were not really involved into the patient's journey. So professionals such as primary care receptionists, which through some of our trainings are now following the patient's journey. So it's very exciting. We're very proud to receive proud and honored to receive this award. And long may the work that we do continue. And we'll invite you to have a conversation with us about how this simulation tool could potentially work for your team. So thank you very much for this award. Thank you.
Congratulations again. Thank you. Amazing, amazing team. And on to the individual award. So this individual created a palliative care unit in 1993 in the San Juan de Dios Hospital, has been involved in achieving home care agreements for end-of-life patients, achieved training certifications. Since 2010, has led a project around improved quality of life for patients through skill development of family members and volunteers that have received various awards. He teaches master degree programs and has led a palliative care unit for 25 years. And his mantra in work is summed up as you care for the patient both scientifically, but also, and especially at the end of life, the human connection truly making a difference, which is something else that Kate truly worked on as well. So I'm delighted to announce that the winner is Dr. Jacinto Batiz, who unfortunately can't be here tonight, but I have an acceptance speech to read out on his behalf, whilst Blanca Usoff comes to the stage to receive the certificate on his behalf. So I will read out the acceptance speech as Blanca comes to the stage. So for a palliative physician, it's a great honour to be awarded with the European Kay Granger Award for Compassionate Care. And at the same time, it makes me feel a great personal satisfaction to be recognised for my work of caring after the patient and his family with compassion from the bottom of my heart in order to turn the transition from life to death in a less traumatic experience, avoiding unnecessary suffering. It's me who has been distinguished with this award, but I want to make participant of it in first place to all the patients and their families who, along my 40-year career, have allowed me to share their intimacy in suffering and in frailty, and from whom I've learnt the way to take care with compassion. To my companions in Hospital San Juan, who have worked with me to do it the way we have been awarded. To those people and institutions who have nominated me for this award, and, as it couldn't be in any other way, to my family, whom I've asked for lending a little bit of peace of their hearts to me so that I could give it to my patients. Thank you all very much for this award. So if Blanca's around to come to the stage to receive the award, thank you very much, and a round of applause for Juan. Thank you very much. Maybe she's not around, but we'll make sure that this gets to the recipient. And thank you all very much for the Kay Granger Awards.
Chris, thank you very much.
Thank you.
Come sit with me for a minute. So, you're on a sabbatical, trying to get this message across. So here's an audience with physicians, with nurses, with administrators, policymakers, industry. How can each and every one help to get this message across the world and actually give some assistance to your great endeavor?
So first and foremost, like I mentioned, the campaign is such a simple idea. It's an introduction between two human beings that we all do every single day. It takes little time to do, it costs very little money and makes a difference, not just in healthcare, but in all walks of life. And my thoughts behind it and what I wish on my sabbatical is that people will fully embrace the campaign, actively talk about it at events, in hospitals, to each other, and go away and think to yourself, do I actually introduce myself every time I meet somebody or every time I see a patient? And I bet the answer is probably not all the time. So it's just making that step to make sure that happens more often than it doesn't happen.
So creating awareness, one way is to also use the hashtag, of course, but you also got a great website with great stories and examples on it. Can you name the website for the audience, please?
Yeah, so the website is hellomynameis.org.uk, and it is filled with educational resource. It's where we can donate money. It's where you can find out more information about the backstory to the campaign and to my amazing, inspirational, beautiful wife, who, like I said, sadly died at the age of 34, but made a difference in those years that she had on this planet.
Ladies and gentlemen, Chris Poynton, thank you very much.
Thank you very much. Thank you.
Thanks again. So that brings me to the wrap-up. Sorry. Oh, you're here. So the acceptance of the Kay Granger Award, after all. A great round of applause, please.
Sorry. Congratulations. No, thank you so much. Yeah. No, thank you so much again.
Leaves me inviting you to the exhibit hall that opens tomorrow at 8. Of course, the joint keynote starts at 8:30 in the auditorium, and the topic will be accelerating the digital transformation. You, of course, still can use the HIMSS mobile app to review the program, matchmaking sessions, and rate feedback speakers and sessions, of course. Please use the hashtags still. Have a great look also into the personas, and we'd like to invite you all to the barbecue in the garden. Thank you very much and have a great evening.